I am so passionate about research in medicine because research is what makes medicine move. Every day here in emergency medicine, we're all about the data. What does the data say about this test? What's the sensitivity? What's the specificity? What is the best test to answer the question that I have? Further, what is the best intervention to save my patient? We don't get those numbers and we don't get that information unless we do research. And in emergency medicine, we are kind of coming into our own when it comes to doing that sort of research. It's highly established in the other specialties.
One of the things that's unique about the Department of Emergency Medicine is the resident research program. The resident research program is really a commitment that we have to our trainees to mentor and teach them in learning how to conduct clinical and translational research. One of the things about our department that is unusual is that we have a research coordinator that's dedicated to resident and medical student projects. We also have a physician scientist training program, which is really our department's commitment to train the next generation of researchers in emergency medicine.
The research in our department has grown exponentially over the last year, thanks to investment by our department head, Dr. Nugent, as well as our vice chair, Dr. Moore, and the research staff that we've been able to develop. Previously, residents or physicians would have had to do their own recruitment in the emergency department. Now we have research staff that does that. And thanks to that, we've been able to recruit additional projects through industry funding and also getting federal funding. And through that federal funding, also been able to build our research analysis team and recruit PhDs such as myself to be able to help write grants that are more likely to get funded and be able to get that funding, which has really seen that big growth in our manuscripts.
The things that excite me most about research here at the University of Iowa is just the opportunities. You can find faculty or mentors in any specific niche that you have in research and really explore and delve into those opportunities further.
At our program at University of Iowa, we're unique from other residency programs in that we have an academic project that is a research project required for our graduates. So it's a hypothesis-driven research project that residents start intern year and complete by their senior year. So I think that's special for here. There's faculty development opportunities both through the University of Iowa and then through the department itself.
So I think what makes the university hospitals so unique is that it's the only comprehensive academic medical center in the state of Iowa. And so the variety of cases that we're able to see here, the variety of learners that we're able to teach here, the academic support, the clinical support. In general, the university hospitals is a great place to learn how to give care as well as to actually deliver the healthcare itself.
The element of teamwork is just so important because when we're doing research, we're not doing this as individuals. We're all contributing some area of expertise, some skill set. And so we might start off with one idea, but once we bring in the perspectives of somebody else who's trained in a specific area, we're building on each other, and we're building on making an idea even stronger, or a better question and a better approach to doing research.
The Department of Emergency Medicine is a great place to do research because they truly believe in team science.
Our research wing of our department has really been a very up-and-coming part of the department over the course of the last several years, both in terms of the number of projects that are being done as well as kind of the overall scope of the projects.
And I think from the research perspective too, their minds are so open and want to know, like, what are you guys interested in? And I feel like you'd have support in whatever type of research endeavors you wanted to pursue.
The exciting things right now is, number one, we're one of the study centers for a big national COVID study in terms of exposure to COVID for emergency medicine providers.
And so that's a CDC level research that we're doing here in the department.
And so we're getting our blood drawn and nasal swabs done for COVID every couple weeks as part of this big research study. And part of that is to determine what the risk of exposure is for emergency medicine providers and how well our PPE is working. So that's one of kind of the bigger projects we have going on right now.
We also do health services research here to see how healthcare delivery systems affect the care that patients receive, and so that's also a strength of our department. And then we also do extensive all-terrain vehicle injury research here, which has led to policies that have been established in our state and disseminated around the world in regards to safe ATV use.
I've done some research projects with medical education previously, and then I'm starting a project related to convalescent plasma in COVID patients.
And so here, the research that I'm personally interested in is infectious disease research. And so the research that I'm pursuing is about Lyme disease, tick-borne illnesses specifically, anything from arthropods, vector-borne diseases. So my research interest is in that. It's a wonderful collaborative environment. And so my research is just getting off the ground. I really hope to continue this further along in my career.